Welcome back to Power Lunch, everybody. Moments away from the big vote on the American Health Care Act in the House. Right now, they're voting on a preliminary measure. President Trump keeping a close eye on what's happening on the Hill, tweeting about it moments ago and pushing back his departure to New York City by 3 hours. Let's go to Elon Mui on Capitol Hill. What are they voting on now, Elon, and when does the big vote come up?
Tyler, the House is voting on a series of measures this afternoon. The health care bill is the second one that they'll take up. Right now, they're considering a related provision that would require members of Congress to be subject to the American Health Care Act and its provisions. So that means that Congress has to abide by whatever they end up passing later on today. Now, that vote will probably happen in about 20 or 25 minutes, that vote on the health care bill, after they wrap up this first provision. We heard House Speaker Paul Ryan give a speech on the House floor earlier this afternoon. He was met by thunderous applause, and it's important to note his rhetoric in that speech. He used images of hope, of optimism, and the idea that he wants to build a better future for the country. That's very different from the rhetoric we had heard previously about Obamacare being a disaster, something that would take the country into a downward spiral. So there's a lot of optimism, a lot of hope here on the floor on Capitol Hill as this voting gets underway.
All right, let's bring in now our healthcare panel. It's Kevin Counihan. He is former CEO of healthcare.gov. John Goodman, senior fellow at the Independent Institute, and joining us on set, CNBC contributor Larry Kudlow. And I just want to show and explain to people that we're showing a vote. That is not the vote to repeal Obamacare. And it's a double negative. It is a vote that would exclude the provision to exclude Congress from having to use all of the provisions of the new health care law. In other words, it gives Congress the ability to choose, pick and choose for him or herself, which provisions of the health care law that they would like to have, because Obamacare forced them to buy on the individual marketplace. So it's, dare I say it, a self-serving vote by Congress right now. That's that. Then the health care vote will be after this.
Allows them to vote on a new bill.
If that makes sense, then the audience is smarter than I am, which I suspect they are. Bottom line, Kevin Counihan, does this pass health care repeal?
Well, you know, I think there are three key challenges to this legislation. Number one is that it hasn't been scored by the CBO, so we don't know how much it's going to cost or what the impact on the uninsured is going to be yet. My suspicion is the fact that since it was designed to attract more Freedom Caucus members, that it will probably have a deleterious effect on the uninsured. The second is that we really don't think anybody can say what the impact on pre-existing conditions folks are going to have, because while there's a fixed amount of money that's going to be dedicated to people with pre-existing conditions through the high-risk pools, we don't know how many states may be applying for the waivers. So, for example, if 2 states apply for waivers, there's probably more than enough money. If 19 states apply for waivers and are approved, there's probably not. So there's a big variable there. And the third is that the bill deals with is trying to address the issue of insurance costs and insurance premiums, but it really isn't the problem we've got in our country. The real problem we have is health care costs. And that's something that is a broader national issue that we have to deal with.
John Goodman, why aren't we talking about that? I tweeted out today, I said, here's what the GOP says. We're doomed if we don't repeal Obamacare. Here's what the Democrats say. We're doomed if we repeal Obamacare. Are they both right? I mean, is the health care system so broken, obesity, everything else, that we're not going to fix it no matter what we do?
Here's one thing the Democrats got right. The Republicans are taking $1 trillion over the next 10 years out of health care, and they really are cutting taxes for the rich and the special interests, and most of those special interests weren't even asking for a tax cut. But here's something else that neither party pointed out. When all's said and done, if this bill becomes law, hardly anything will be changed about the structure of Obamacare. In other words, every state will still have an exchange. There'll still be an open season once a year. People will be able to move back and forth. That premiums have nothing to do with their health care costs. That's why we have the race to the bottom right now in the exchanges. And worst of all, the group market will be able to continue to dump high-cost elderly patients on the individual market, and that's why we have a death spiral.
Can I just ask John Goodman, John, old friend, your first remark, are you referring to the means testing or the lack of means testing for the tax credits, that not enough subsidies are being pushed to the so-called working poor at the lower end?
No, you know, the Democrats put $2 trillion on the table for health reform, and I've always believed we should have used that money to reform the health care system. Paul Ryan is into tax cuts, so he gives the money back to the special interests who helped give us Obamacare. That's the insurance companies, the pharmaceutical companies, the self-insured companies. All those folks get a tax cut, and it takes money out of the system. So the CBO is predicting by next year's election, we'll have 14 million additional uninsured, and then 10 years out, we'll have 24 million uninsured. That's because they're taking money out of Medicaid and reducing the amount they're spending on subsidies.
Well, I don't know. I'm not sure I agree with that logic. I think one of the big issues here is the essential benefits mandate, which, as I understand it, Lord knows, will now be handed over to the states so they make their own decisions. If you remove that, that opens the door for massive reduction in premiums. A massive reduction in premiums.
Let me make a prediction to you. Let me make a prediction to you that hardly any state's going to ask for the waiver, and even if they do ask for the waiver, no state is going to take away the coverage for mental health and drug abuse. No state is going to take away a maternity coverage mandate, and no state is going to take away the mandates for contraceptives. So they're all going to stay there. It's very hard to repeal a mandate.
Well, I know, but this at least opens the door. It gives choice. I mean, Ryan's a guy who believes in choice, and I also have to believe, gentlemen, I just have to believe that this takes a major step. Let me just hang on one second. This takes a major step towards dealing with the people who are ill. You cannot charge healthy people the same as you're charging those with the, who are ill. You just can't do it.
As I understand it, Larry, I mean, if you are covered by an employer's health plan, which we all are, you actually could be affected by this because the employer's insurance company can choose which state to comply with. So then I will be forced to, even if I live in a state that does not opt out of providing the coverage for the 10 essential areas,
your insurer
I could still, exactly, the insurer could, and so therefore I will be subject to that as well.
Can I respond?
Yeah, of course,
So John Goodman, but there's a reason for that, right? According to the Kaiser Family Foundation, some states, mostly in the South, 33% of people in Alabama and Mississippi and Kentucky have something that would fall under a pre-existing condition, while Colorado has just 22%. So
well, those are just nonsense numbers.
You're calling the Kaiser Family Foundation's numbers nonsense?
Those numbers
are
nonsense.
The leading nonprofit, nonpartisan medical research
those particular numbers are nonsense. Now, before there was Obamacare, in the individual market, insurers could refuse to cover people who were uninsurable. Less than 1% of the United States is estimated to be uninsurable. So the Kaiser number is just way wrong. Now, what is the right way to handle all this? What's the right way to handle it is to create a market for sick people. We should have Cancer Treatment Centers of America, MD Anderson, everybody else who wants cancer patients advertising and trying to say, if you have cancer, we want you. The diabetic centers should be trying to attract diabetes patients. Heart centers should be trying to do that. What's happening right now is they're all running away from sick people.
Uninsurable is one thing. Pre-existing conditions is totally a separate thing, it would seem to me. I don't think that the two are equivalent. Kevin, let me ask you, do you believe that vast numbers of individuals who have pre-existing conditions, not who are regarded as uninsurable, will they be better off? Will they be able to get affordable coverage under this new law at the same rates that they did under the ACA?
I believe that we will not. We don't know that, number one, because we don't know how many states are going to be applying for waivers. I don't share John's rosy view that no states are going to be applying for that. I think, in fact, there's the risk that there could be a race to the bottom, and that's something I think that is concerning. So I think that that's an unknown question, but it's a real risk. The second is I also really question that John's numbers. That seems to be an extraordinarily optimistic view of the number of uninsurable in the country.
Who's going to, I just want to know this, John Goodman. What you said, we need to create a market for people with pre-existing conditions. Okay, I'm a pro-market guy. But in your judgment, doesn't the federal government have an obligation to subsidize those folks? They're at the low end, John.
No, I don't have a problem with the subsidies. The problem is that every health plan in the exchange has a perverse incentive to attract the healthy and avoid the sick. So we have a real race to the bottom, that's going to continue even with the Republican bill. So in the city where I live, Dallas, Texas, UT Southwestern, our premier medical facility, is not in any exchange plan. Children's Hospital next door, a premier facility, not in any exchange plan. So they're leaving out the best doctors, they're leaving out the best facilities because they don't want sick people. And what I'm saying, Larry, is if you had the right premium attached to the right patient, there would be a real market to solve these problems. People would try to attract people with problems instead of running away from them.
You're saying this doesn't do that?
Oh, not at all. This just continues all the perverse incentives that are already in Obamacare.
We got to leave it there, guys. Thank you so much, John Goodman, Cuninhan, Larry Kudlow. I think you're sticking around. I hope you're sticking around. Anyway. I want to get to this tweet that just crossed from President Trump 4 minutes ago. The tweet reads, if victorious, Republicans will be having a big press conference at the beautiful Rose Garden of the White House immediately after vote! Exclamation point. That is word for word. That's the tweet right there. And that perhaps is why he delayed his departure to New York by a few hours.
He's watching us. He's watching us.
He's watching the vote, that's
Real
for
time.
sure. I mean, it means a lot for his administration, right? Points on the board.
Huge. Stakes are very high, political stakes. You're right.
I know we're over time, but we're all just kind of ad-libbing here equally. So I'm just going to say that the fact that John Goodman discounted the Kaiser family numbers is unbelievable to me. Unbelievable. Nonpartisan group.
John's a good guy.
I know. I didn't even get to respond. It's
Smart.
ridiculous.
We wanted to let you know that the House has begun voting on the AHCA. So this is the vote that we have been waiting for all afternoon. Certainly, this is one that is being closely watched by the Trump administration, President Trump himself. So the move to repeal
What's
Obamacare,
the number they can
replace
lose? The Republicans can lose in this? It's 20-something, 21,
21.
and now they're at
According
16
to the latest number
no's.
by NBC News.
But do you know how fabulous that is? The Tim Cook announcement. Fabulous.
$1 billion of
It's a big chunk of change. I mean, there's a headline in yesterday's Wall Street Journal. Big story headline. Chinese worried that U.S. tax cuts will compete for investment. Yes, of course that. If you get through this tax cut bill, including the repatriation, these companies will take the cash and bring it home and invest it one way or another. It's exactly right. And, you know, hats off to them. And we've got a lot of companies going to be like that. This is a just the symbolism is important, but the actual number is important because we haven't had any hardly business investment in years.
How important is this for Paul Ryan politically?
AHCA.
The healthcare vote.
Yeah. Could that have been a career-saving vote or speech that he just gave?
That's a very important question. It's a great question. It's very important, Sully. You're absolutely very important. And it's important for the GOP to show we're running the government and center-right pro-market reforms can be implemented and work. So I think you're right. It's there's a lot of line for Ryan, a lot of line for Trump. Maybe more on the line for Ryan. It's a good point you're making.
Also, there was an article in Politico saying that Reince Priebus was calling around, really lobbying quite hard for the passage of AHCA as if his job were on the line. Do you see that? Do you think that that's the case?
I don't know if Reince's job is on the line, but one of the jobs of a chief of staff, I worked for James Baker many years ago, is to do that. And Reince has particularly good connections on the Hill. So what you're really saying is the Trump White House is pushing hard to get this done. I come back to your redemption point, or Sully's redemption point earlier. They really did bungle it 4 weeks ago. They got a second chance in life. Get it done. And I do think it's good policy. That's just my view.
Does this pave the way for tax reform, in your view?
Yes, very important.
Absolutely.
If nothing else, the legislative battle here is sucking all the oxygen out of the air, okay? Whether or not the numbers, I don't care about the numbers so much. Growth is the most important thing. But yes, this will go to the Senate, and I'm just going to make a bet here. I don't know, but I think the Senate will come back with something that is doable, and I think it will eventually get done, and the pessimists will be surprised, okay?
Well,
That's what I think.
It is going to be tight. There's an hour left in voting. 208 votes for yes. 2 Democrats, by the way.
Yeah, look at that.
18 votes for no. 187 Democrats voting no. So it's 210, 211 now to 205. As we said, you need 216, maybe 215 if one of the Republicans did not show up due to a family emergency. This is going to come right down to the wire.
You know, Sully, I know you're a bit cynical about American politics. Sometimes in these bills, judgeships, bridges to nowhere, projects, They're all up for grabs. You may not see it in the headline, but it's in the fine print.
There are 19.
You got to do what you got to do.
I just copied and pasted HR 1628 into Microsoft Word. Literally, there are.
I was wondering what you were doing.
I'm a weirdo. 19,266 words in this bill. So there's a lot of fine print, Larry, in this. I guarantee you all 19,000, which I arguably have not read, are not all related to health care.
All I want to say is get this done. I believe it's good policy. I believe it moves the ball in the right direction, stops the death spiral of Obamacare. But mostly, I want to get to pro-growth tax reform.
215 in the yes.
216 yay, 216, that gets it over the top, I believe.
If they can hold it, it's done, Ty.
I believe that, those two Democrats who were for have switched their vote now to nay.
It looks like HR 1628. You don't want to. It's not the presidency, the election, quote, call it. But from those numbers, unless something were to switch, it looks very good for the GOP.
They've got the votes.
And the time remaining is 0. Looks like it passed.
I just want to say again, a million times, lurking behind all this political drama on health care is the pro-growth tax cut, the business tax cut.
Yeah.
And that's the Tim Apple story about another $1 billion of private investment. That's the tax cut. This thing's taking the oxygen out of the air. Get this done. I think it is decent policy, but the tax cut is behind it. One leads to the other.
We briefly turned positive on the S&P as well as the NASDAQ moments before the House reached the total number of votes.
It's got it. It's 217 now.
And we've just gone back into the red, but markets here holding in.
So that is a pass, correct?
This one passes, the other one passes. This one passes.
If it holds, unless somebody changes their vote
on the actual bill, will pass, goes to the Senate. I think the Senate will turn it back, pretty much similarly. They're working together, right? They're working together. And then you'll get your conference, and then you'll get your vote. It's going to take a while. We're talking about a couple of months is my hunch, but it won't take forever. And get this tax reform more speedily done. This Tim Cook thing is so apocryphal in my judgment. Really important. Bullish for stocks, bullish for growth, bullish for wages.
Can we listen here to the chair?
Motion to reconsider is laid upon the table. The unfinished business is the vote on the motion from the gentleman from California, Mr. Royce, to suspend the rules and pass H.R. 1644 as amended, on which the ayes and nays are ordered. Clerk will report the title of the bill.
H.R. 1644, a bill to enhance sanctions with respect to transactions related to North Korea and for other purposes.
Let's go to Bertha Coombs, who covers health care. Bertha, certainly a major hurdle passed for this bill.
A major hurdle, but still leaving a lot of uncertainty, just as what is going to happen with this when it does go to the Senate. Already starting to see some of the reaction pouring in from the Mental Health Association of America. We're deeply disappointed in the result of today's vote in the American Health Care Act. The sunny, flamboyant promises of better health care to lower costs during a political campaign gave way to cold, dark realities, according to the MHA. The real issue here is the fact that if this stands, by allowing the states to opt out of certain provisions, each state to decide, as you heard from Dr. Pearl, it adds an awful lot of complexity. You don't know what states are going to opt out, what states are going to opt in, what states might take advantage of the provision to be able to set up high-risk pools to remove the people who were high cost, put them in a separate pool. The funding for those high-risk pools, a number of actuaries, a number of academics have said is not nearly enough if you're going to take out all of the high-cost patients and put them into special high-risk pools. A number of folks have also been very concerned about the ability in the bill for insurers to charge those who have higher cost, pre-existing conditions more should their insurance lapse when they come back into the market. In fact, Paul Markovich, the CEO of Blue Cross of California, blasted that particular provision, and he says this doesn't really help the problem for people who really need care. Insurers overall have been a little bit mum. They like some of the flexibility that it gives them, but they aren't necessarily sure that this is the final version of a bill that is really going to help this market. And more immediately for the insurers, in terms of what is going to happen for 2018 right now, is they are trying to put together their rate requests for next year that have to be submitted over the next few weeks. They do not know whether some of the subsidies are going to be there, in particular the subsidies that go to lower income folks in order to bring down their out-of-pocket costs. So still an awful lot of uncertainty here.
All right, Bertha Coombs, thank you very much. Let's go to Elon Mui, who has been following the vote from Capitol Hill. It was a raucous reaction there at the end, Elon.
Yeah, Tyler, you heard all of that applause, and we are watching lawmakers as they leave the House floor and get onto buses that will be headed to the White House, where the president has promised a big celebration and a big press conference in the Rose Garden now that this important bill for Republicans has passed the House. I believe the final count was 217 to 213, just edging it out there. Again, there are big questions, though, as this heads to the Senate. But for right now, there is a lot of optimism and a lot of hope and a lot of joy here on Capitol Hill with the passage of this bill. Back to you.
All right, Elon Mui, thank you very much. Quick comment, Larry?
Very rare in American political history, very rare to overturn an existing large entitlement.
True.
And I think
Good point.
Yeah.
this is going to do it.
But let's be clear, though, Eamon Javers, it has not been overturned. The House has voted to instill this one. The Senate remains a hurdle. And, buddy, I'm going to put you on the spot. If you don't know the answer, no worries. Do we have any idea when the Senate might receive this, mark it up, and vote themselves?
Yeah, we don't have any idea when the Senate's going to proceed on this, Brian, and that's going to be the big question, because it's not likely that the version that you just saw pass on the House floor can pass the United States Senate. So they'll strip out a bunch of provisions, add some of their own ideas, and send it back to conference committee, where the two sides are going to have to work out what the final bill will look like and what final bill can actually pass again on the House and Senate floor. So there's a lot of process still ahead. Nonetheless, this is a big win for the Trump White House. They were frustrated by their inability to get to a vote on the House floor earlier this year. Today, they got it. They got the votes, and you saw that 217 vote margin. Democrats on the House floor, if you heard right at the end, cheering na 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 na, hey hey hey, goodbye to some of their Republican colleagues, an indication that they feel that this was a political death march for some of the moderate Republicans. They're going to tag them with the idea that they have voted to remove health care from millions of Americans, reminiscent of the 1993 Clinton budget, when Republicans chanted bye bye Marjorie, when Marjorie Margolis Mizvinsky was the deciding vote in that controversial budget, and she did end up losing her seat. So those members who you just saw voting up there on Capitol Hill, a lot of them know their political careers are on the line with this vote. The winning side on its way over here to the White House for a victory celebration with the president. We'll see what form that takes. If we see the president, if we hear from him, you've got to imagine he's in a very, very good mood right now.
You know, I am so glad you were. I thought I heard them singing that old song, the na 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 na, and I didn't know who it was. So it was the Democrats doing that.
It appears to have been the Democrats.
And
Yes.
not the. I thought it was the Republicans saying goodbye to Obamacare. That was my thought. My initial reaction.
It appears to be the Democrats singing that to the Republicans, but
as if they're going to
fair,
lose in 2018 now because
from inside the room.
But let's not forget politically. Let's not forget politically. These big nationalized, I'm going to call them nationalized healthcare plans, whether it was Hillary Care in 1993 or Obamacare in 2010, led to devastating congressional losses for the Democrats who backed them. Remember, the House and Senate changed hands after 93, and the tax hike, it changed hands again after 2010, changed hands again after 2014.
We'll see what happens this time.
So,
by the way, these are live pictures that we're showing you of members of the House getting on that bus to the White House to celebrate the step further that this bill has taken. So it's a victory for now, even though the implications further down the line politically are still unknown.
I think for investors, getting this done or moving this ball towards getting this done is very bullish, because we are going to get a business tax cut that will rejuvenate this economy.
And we can let the market sort of decide what it thinks, the neutral market. Tenet Healthcare, Cardinal Healthcare, hospitals seen benefiting under Obamacare are actually mildly higher right now.
They're not, certainly not suffering.
So the market may be saying, you've got to go through the Senate, You've got to go through conference, perhaps. You could possibly go through the Byrd Rule, which is this obscure thing where you could kill a budget reconciliation process if it's considered extraneous or incidental to the budget. So there's a long way to go in health care. Let's bring back in John Goodman, Kevin Counihan, Larry Kudlow still with us as well. John Goodman, your reaction.
Well, again, I think the Republicans have missed an opportunity to focus on how to reform the health care system to create real markets so that people would try to attract people with problems and solve their problems instead of running away from them, which is happening now. And they missed the opportunity to protect the individual market from the group markets who keep dumping sick people on them. The individual market is only about 5% of private insurance. And all those group plans, the city of Detroit says we're bankrupt, we're not going to pay for our senior folks anymore. They dump 8,000 costly elderly workers on retirees on the system. In Texas, we have 261,000 retired teachers. The promises of post-retirement health care is totally unfunded, as it is in practically every plan like that in the country. Texas could end that plan, send all those folks to the exchange. That's a number equal to about 1/4 of the enrollment in the exchange. That would be huge. And if they're allowed to do that, the exchanges are going to all go into death spirals. Nothing in this legislation deals with that problem
John
at all.
Goodman, why? Just let me just look. You know more about health care than I do, but let me just pose this question. The federal government is going to put about $140 billion into these preconditioned ill, sick risk pools. $140 billion via the states. Why can't this be done through a voucher system, which has been proposed, in which case the individual people who will have this to cover their illness can shop around and strengthen private market exchange? Why can't that be done?
It can be. Essentially, we do that in Medicare Advantage program.
Why can't we do that here? Why not?
What happens in Medicare Advantage is that no matter how sick you are, you're attractive because the federal government adds to your premium, and so you have special needs programs that are getting $60,000 a year for taking care of people with lots of problems.
That's a win, John. That deals with your issue, doesn't it?
Hey, I put this in the Sessions, Cassidy bill, and Paul Ryan ignored it. And I'm just saying there's an opportunity, which I hope comes back in the Senate, to solve real problems instead of just focusing on how we reduce spending and reduce taxes.
All right, gentlemen, we're going to leave it there. Take a quick break. We'll be right back.
And we are taking a look at a live shot of the White House. Members of Congress are headed there by bus from Capitol Hill to join in at a big press conference, using the words of the president. He tweeted earlier that Republicans would have a big press conference at the beautiful Rose Garden of the White House immediately after a vote if victorious. They are victorious, so they are heading there right now. Let's bring back Kevin Counihan and John Goodman. Kevin, I want to get your reaction to this vote, to the passage.
I think a key challenge is going to be that, as we know, the prior bill had a 17% approval rating by U.S. citizens. I suspect this bill may be less popular. So I think politically there's going to be a challenge for the party as things move into the Senate, and that probably will not be lost on the Senate. The second is that there are means within the current legislation, for example, known as a risk adjustment formula, that particularly allows insurance companies that are attracting sicker people to be compensated for that. So the existing legislation actually has a lot of means, in my view, that can be refined and tweaked to make things even better and productive.
Gosh, I think, you know, with all respect, the risk adjustment, the risk corridors, that stuff was bankrupting the bill, bankrupting the budget. There was no end to it. I mean, that's part of the death spiral we've all been talking about. You can't do that. The Congress cut that off. Even Obama gave up on that. I'm sorry. That system has to be fixed. You have to get more people into the system. And the way you do that is by getting rid of the mandates and letting the cost of the premiums fall in a market engendered approach. That's the way to do that. You can't just keep subsidizing insurance companies.
Yeah. With all due respect, the risk adjustment formula was revenue neutral, meaning that companies with higher risk were paying those with lower risk. It did not require a subsidy from the government.
But it went over budget, sir. It went way over budget, so that it was taken up in the last Congress. The last Congress, it was so far over budget. I'm sorry.
May I say something on this? What the insurance, this was designed by insurance companies. And what risk adjustment means to them is If Larry and I are companies and he has losses and I have profits, I'm supposed to write him a check at the end of the year. That's private sector socialism. What real risk adjustment means to me, market-based risk adjustment, is what we do in Medicare Advantage. The payment follows the patient, regardless of what happens to the profits of the insurance companies.
Kevin, does anything in this bill, H.R. 1628, or what the Senate has talked about, do anything to bring down the cost of health care as opposed to figuring out how to pay for health care? Why isn't anybody talking about how to bring it down? Why are we so sick? Why are medical malpractice insurance costs driving doctors out of business? An OBGYN, hundreds of thousands per year in malpractice insurance costs. Does anything in this do anything to address that?
Well, I think you've underscored an issue that I tried to raise earlier, which is that this is not just about going back to the past, providing mini-med plans again, increasing the risks of people having more personal bankruptcies. It's really not addressing, I think, which is the core issue, which is healthcare costs. Pharmaceutical costs in our country are just too high. And this is becoming an issue not just for individuals, not just for small businesses, but large corporations as well. And we fundamentally can't keep kicking this can down the road.
So I take that as you do not see anything in here. And the big criticism of Obamacare was precisely that it did nothing. It increased access to insurance, but it didn't do anything really to govern rising health care costs. And you don't see that here.
See, what I would just suggest to you folks is that that's a little bit of an oversimplification of the bill. So, for example, there were many parts of that legislation, for example, the creation of ACOs and other things, and creating more risk-bearing entities that, in fact, tried to address that. But your point broadly is, in my view, is absolutely correct. This is the 800-pound gorilla in the room. We have to address it.
I just think, though, the mandates were the problem. You cannot mandate benefits. People do not want to choose the most expensive plan that doesn't work for them. Family budgets matter. So this plan, as I understand it, Lord knows, A, takes out the general mandate, which Justice Roberts called a tax, and B, opens the door to flexibility
wasn't the real problem
on the essential benefits mandate.
That's
a key point.
Wasn't what was driving the insurers out of the states the idea that more sick people came into the plans than they anticipated, and that it was costing them more to provide the coverage, some of which was the mandated coverage, but most of the expense, forgive me just a moment, most of the expensive coverage goes to 2% of the insured people who are not pregnant and don't have mental health problems, but do have fatal disease.
Is that healthier people didn't join as much.
The healthier people didn't join.
To offset, to disperse
the younger, healthier people.
And so they couldn't make a profit.
They were the financiers of the elderly and the sick, and they wouldn't do it.
Right.
They wouldn't finance it. And no amount of government subsidy is going to change that.
Jump in.
Folks, Obamacare is designed to overcharge young, healthy people and undercharge older, sicker people. So, of course, the sicker people joined and the healthier people didn't. And that's always going to happen if you get the prices all wrong.
Here's what I don't understand politically. Maybe, Larry, you're the best person to ask this, is in some ways, the vote for president went exactly the opposite of the way it should have. To John's point, if younger people were going to pay more, older people are going to pay less under Obamacare, but older people overwhelmingly voted for Trump, who then may be raising their health care premiums. It's not a political. Okay, we're going to take a short break, and we'll be back right after this.
I'm not going there.